Hello, it's Mary Lou Novak with resource4care.com, and we provide educational information directly from healthcare and wellness professionals in the Mid-South area. And today we have Dr. Tabor-Cobb. Welcome.
Thank you.
And Dr. Camille Tabor-Cobb has a unique organization where they go into people's homes and provide, wherever they may be, right, whether it's assisted or independent or their own home, and provide dental services. But our topic for today is the connection between mouth and body, like that mouth and body connection, and what maybe elderly people or those that care for them should know about this.
Yes.
And I don't know a lot about that. I did, look up a few things before today, but for the most part, I'd never made that connection. And did you know that going into dental, or was that something you found out?
No, definitely something I found out.
Okay, tell us about that.
So in school is basically where we found out. We were taking the same courses as a MD or a medical physician would take the first 2 years.
All the biologies.
Yeah, all the biologies and everything.
Anatomy,
the schools are just separate because of the fact that it's a lot of work that we have to do. But we take the same classes. And it did not hit or dawn on me that the connection was such a close thing or close topic until probably our third year.
Really? And how many years do you go to school to be a practicing
Well, you need
dentist?
a college degree,
Yes.
and then you will attend 3 to 4 years of dental school, depending on the school you go to. The third 3-year program is, of course, a fast track, but traditionally it's a 4-year.
Okay.
And you can start practicing straight out of school after those 4. We don't have to go to residency unless you choose to do that for a specialty care.
So was it in the course of learning or practicing your craft? That
I
you found
really
this
think
connection?
it was in learning,
Okay.
but I think it didn't really click until I was actually practicing.
Okay.
So, when you're in school, you're so busy trying to get done with
Get that
requirements.
grade,
It's like
on to the next
you're a robot.
class.
Yes,
Right.
yes. But once you're out here on your own and not anybody holding your hand,
Right.
that's when you have to sit and you actually have to pay attention to the person's health history. That's when it kind of hits and you realize, oh, well, if their blood pressure is high, I can't take this tooth out. I'm about to give them some medication that can make that blood pressure go up even more and cause
that knowledge.
Yep, and then the patient, understand that your stroke level or risk can go higher, or you can have a heart attack right here in my chair.
Yeah.
So that's when it was like, oh crap,
Right.
I need to pay more attention to this medical history.
When I first heard or we talked about the topic, I thought of like the chicken or the egg. Like, is it your health that affects your mouth, or is it your mouth that affects your health, or is it a little bit of both?
That question is, definitely something that's still out there in the air.
Okay.
But I feel that it kind of coexists together.
Oh, I see.
So
It's the connection.
it's
not
like
one or the
basically
other. Gotcha.
if you're already dealing with health issues, so say it's genetic because you're predisposed to high blood pressure.
Right.
But you have a healthy mouth, you may lower that risk of you making that disorder, that condition worsen.
Okay.
But if you are dealing with poor oral health, then that risk of that condition may worsen.
It exacerbates.
It's exacerbating,
Right,
yeah. So
right.
now you're actually making your body fight 2 different things, and it has to decide: am I going to put this energy here,
Right.
or if I'm going to put it here, or try to divide it between the 2?
Right. So something that might be like a gum problem or a disease or an infection that your body's fighting in your mouth. I'm getting to understand that connection.
Oh yeah.
Yeah.
And it's, a lot of people pay more attention to the cavities, though cavities are important.
It's a measurement.
It's
one measurement, right?
It is, but gum disease, I would say, is probably more destructive because of the time it takes to actually do the damage. Cavities take a little bit more time.
Sure.
And usually, at worst, an infection can be your demise. It can, it can cause death.
Yes.
But it takes a little bit more time.
Okay.
And you will lose the tooth, of course.
Right.
But gum disease, the infection from gum disease, it causes inflammation. That inflammation travels through the bloodstream,
Right.
and that travels to the rest of your body.
Yeah, it's interesting because unfortunately, I lost my brother due to an infection. He had diabetes, and he had a hair follicle get infected in his neck, and the infection attached itself to the neck, and they had to go in and do surgery, and he ended up passing away from cardiac arrest.
Sorry to hear
His
that.
body
Yeah.
just couldn't, with the diabetes,
Right.
just couldn't fight the infection the right way.
Right.
And just think about how often, as we get older, we have more gum issues and
Yes.
more infections and things that happen.
Yes.
Wow.
And then on top of that, as you age and the immune system doesn't fight like it did
Yes.
when it was younger.
Right.
And then you may be dealing with having more medication that you're on.
Sure.
So with having more medication, some of them, including ones that are, especially blood pressure medicines, they decrease the amount of saliva.
Interesting. I didn't know that.
So decrease in saliva, that means that your mouth isn't able to regulate itself.
So your saliva has like enzymes and things in it?
So that
Okay.
actually neutralizes our mouth. So we know with decay, cavities are started when your mouth is acidic. Meaning if you're a person that eat a lot of tomatoes, suck on lemons, you have GERDs, meaning gastro vomiting from GERDs, or even you drink a lot of juice, soda, tea, coffee.
Right.
You're leaving your mouth in that acidic range. Drinking more water, you in that neutral range, which is around 6 or 7.
I see.
So, I explain to my patients and people in general, the best way to look at it, when you're sitting and drinking those beverages, you're sipping, then you stop. That's a clock that's constantly going. So that clock, your mouth actually with saliva slowly neutralizes itself, but it takes about 30 minutes to do that. So you took that sip and you starting that clock. But when you take that sip again, you start that clock back over. So that means you're in that range longer. And what do? We mostly sit and sip.
Sure.
We don't just drink it all down. Yeah. And so that's why it's important to make sure that you're drinking water, or even after eating, because our food, it has sugar or carbs, because everybody thinks candy. It's not candy. It's our diet as a whole.
Yes, it's the foods that convert to sugar.
Exactly. And then those who provide medications to their family members or even to patients with a carrier. So you know how they crush the medicine, put it in, say, applesauce or yogurt. A lot of them are food holders. So that's just sitting in the mouth. So you have to
getting into the system.
Force them to swish. Force them to drink some water. Because now if they're not getting proper dental hygiene care every day, you have to help them to combat those two diseases from getting worse.
Never thought of that. So are you finding that it's a big issue? I've never really talked to anyone about dental. I talk so much about the rest of the body with the podcast that I do, but not really dental. Are our seniors really suffering from not having regular care? Is this a big issue?
It is. And I believe it's a big issue because you're caring for that person in so many other ways that the mouth is kind of one of the things that is not being on the list. It's not visible. It's not, and I was going to say, and then when you have a family member who can't communicate something to you, you don't think anything's wrong. And I can say, as a population as a whole, a lot of us, dental care isn't big on the list because we usually have the mindset, if it's not hurting, we don't take care of it.
I just had my husband tell me that yesterday. He's like, I know last time I went, I had an issue and I need it, but it's not hurting.
Yeah, but the thing is, when it hurts, what does that mean? That means it's time to probably take it out, and the cost is astronomical. So when people start talking dental care costs a lot of money, it costs a lot when you put off the preventive part. If we pay more attention to the preventive part, that's when the care is cheaper, even with those with insurance. Usually for your basic cleaning, you're not out of pocket any money at the dentist. You're paying a premium, but you're not out of pocket.
Yeah, and that, unlike hearing, which I've talked to, one of my other colleagues about, hearing isn't always covered because not everybody has a hearing issue,
Right.
but everybody needs to see the dentist.
Yes,
So
yes.
you usually have, with whatever coverage you have some type of dental, right?
Right. Usually,
Not
some
always,
people
yeah.
opt not to have it, but it's usually cheaper. If you're already paying for medical, it's only an extra few dollars for you to have that
Right.
dental tacked on to it.
So we're like, 10 minutes left. So what is it like, either something that comes up often that you just wish you can, wave your magic wand and have everybody know, or something that, gosh, if people just knew this, things would be much better and their lives would be better, or there would be some kind of impact. What comes to mind?
Man. Well, I would say I wish I could say that I wish that all medical providers, we could work together as one and kind of help each other out. Because when your MD looks in your mouth and look in the back of your throat, you're
Right.
passing teeth.
Yeah. You're already
You're already
in the
there.
neighborhood.
You're in the neighborhood. If you see something, because we as dental
Right.
providers, we know the body. We may not know it specifically. We may not be the heart
Sure.
doctor, but we understand those parts of the body. And if something's wrong, we could pass the buck
Yes.
and say, go see this person. So I wish that was one.
Right.
But also those who, just because you don't have teeth, you still need to see a dentist.
Sure.
Because there are still conditions that you can have in the mouth. The biggest one that I'm seeing amongst seniors in particular
Right.
is cancer.
Yes.
Cancer in the mouth, it is slow, but it's aggressive. And it can take us out fast. And
Okay.
usually when it gets to a point where it's there,
Right.
your days are pretty much numbered.
And I've noticed, I'm fairly on the old side, but when I used to go to the dentist, they never would check your mouth the way they do now.
Yeah.
The dentist comes in, they lift your tongue, they move it from side to side. They're looking for any type of
Any abnormalities.
Yeah, abnormalities. But I would think that probably came from people discovering cancer. Yeah.
Especially under dentures. And if you have dentures or partials, they
Yes.
need to be removed daily.
Okay.
Because, one, the cancer can be under there. Also, the gums need to breathe.
Yes.
And also another thing people don't understand is that one denture is not forever. Your bone continue to shrink. Dentures are supposed to fit. You don't supposed to use glue. It's so
Right.
many number of things.
Yeah.
But continuously having that care and going to see someone
Right.
is so important. And we found patients who had diabetes and not known it by looking in their mouth.
Really? So how does
Taking
that
your
come
blood
about?
pressure. We
Right.
have found out that you have blood pressure. Well, for diabetes, their breath smells sweet.
Interesting.
You can have a bunch of abscesses in your mouth, but it's nothing wrong with the teeth. Uncontrolled diabetes.
Right.
And those are some of the signs that we notice.
Right.
And we can see you in. But myself, when a person, sometimes I check sugar when I'm actually seeing patients. I check
Okay.
sugar and I check blood pressure, and then we have that conversation.
Sure.
Now, yes, I'm a dentist and be like, you only here for my teeth. I'm here for you.
Right.
And that's what's important to me.
Exactly. So, how does it work when you, well, first of all, I just want to say, everyone hear what she's saying. If just because you don't have your own teeth does not mean you don't need your dental checkups.
Yes.
Please. We just gave you a bunch of reasons why. How do you do mobile dental? Like, I see all the apparatuses when I go into the dentist, right? And I'm thinking she's got a U-Haul or something and pulls up and, or puts a portable chair on her back. I don't know. How does it work?
Well, I have a portable equipment. So
Okay.
just like you would see the hand pieces suction and everything, they actually have it in a portable
Really?
suitcase size tote. So
Interesting.
I'm able to take it apart, put it together. Only thing I need is an electrical plug when I come to your house, and everything is done. And I need
Wow.
an area to work in.
Right.
And all my tools, you put it in, and I have a pulley bag, and I have my laptop computer, and I need internet, which I
Yes.
carry on my own.
Right.
So, and I
You
set
should
it
do
up,
yeah.
and I have a portable chair if you're a person who can walk and don't have to be in the bed. But I'll see you in your bed as well. I've actually had to get in the bed with a patient beside them because of the way that they're positioning.
Yeah.
So,
yeah.
and I don't
Sometimes-
mind.
Sometimes they're limited. Oh, that's beautiful. I'm so glad.
But it all fits in my car. I have a Avalon, and it fits in the car, and we make it work.
Wow. And how long have you been practicing mobile dentistry?
Mobile dentistry, 8 years.
Wow.
8 years.
In this area?
In this area.
Okay.
So the whole West Tennessee for a while, but I've now just the Memphis area, and I'm about to move into northern Mississippi.
Okay.
Yeah.
Yeah, there's a lot of growth down there. Olive Branch and South Haven. And
Yes.
How far south will you go, do you think?
I'm not sure, but the rural areas of the Delta of Mississippi are the ones who are calling for me right now. So I'm just, wherever, my heart and God kind of leads me, that's where I'm going.
Beautiful. Yeah, until they opened the hospital in Olive Branch, all of my clients were coming to Memphis.
Yeah.
They all had to travel. So at least now they have a medical facility in Olive Branch and they do have one in South Haven, but it's further down. Yeah. Okay. Well, I would just want to take a moment to recognize one of our sponsors, which is Genell Holloway, and she's with Eagle Hollow Enterprises. Genell is a specialist in insurance, for medical insurance, and she gives her time freely. So if you have questions or not sure what coverage you do need, or maybe not knowing what gap coverage you might need in addition to your regular coverage, she's a great resource. And we'll put her number up on the screen when we publish this, so that you can reach out if you have a question. So you're expanding into Mississippi. Are you giving a full service of dentistry, or is there room for expansion in what you're doing? So, I mean, I know you said everything's portable, but like you fix the cavities and everything, or do you refer people for certain things?
Well, I do not do ortho, which is braces. I do not do root canals because in implants. So those a little bit more time, and yes, they're surgical, but also the time. And because like root canals as well as implant, those are more intricate surgical procedure, and they need to be in more sterile environments. And in homes that's kind of hard to do. And so those services I do not do, but I do dentures, I do fillings, I do extractions, and I'm able to take x-rays. A lot of people are shocked that I'm able to take x-rays. They have a little portable x-ray gun.
That is amazing.
So I'm able to do that as well, and we do exams as well. I might throw in some little whitening there, because I do find some of my patients at home, they're there at home. As you age, your teeth darken. They want to still have that dignified smile for their grandkids when they come over, and so their grandkids will still say, "Grandmother, you look nice."
I mean, dignity in all types of care is so important.
Oh yes.
Especially if they are people that can't get out.
Right.
We have a gal that has been on the show that does mobile manicure and pedicures.
Yes.
So, you think, well, what does that have to do with health? Man, when people feel good, right? And
trust me, I have some. Health. They won't let you in until they put the rollers out their hair. So I understand. They want to look just as good as if they're coming into your office. And I want them to feel that way as well when I leave.
Sure. Okay. So is there other things that you'd like to share about the connection between body and mouth that we haven't talked about?
Well,
come to mind?
My family, my sisters and friends, they always get on me. But they want, one of the things we constantly keep talking about, heart disease or, heart and blood pressure and diabetes. But, it's other things that, kind of connects with the body.
Okay.
And one of the biggest one, and, I know that it's kind of comical to me, but it's important because, as you age, your body still works. This gum disease also can affect infertility. And I know older people are not, having children.
Right.
But their families are.
Yes.
So that is big. And it can affect birth weight. But for the men, because, they still want to have fun.
Sure.
And I'm not trying to go down that line. It'll be funny. But it affects erectile dysfunction.
I didn't know that.
I mean, if you think about it, you know, when that happens, you know, it's blood flow going into the man part. So inflammation, so it constricts, so you're not able to get the blood flow.
Wow.
So when I say inflammation to every part of the body.
Right.
If you're someone who's dealing with kidney disease, inflammation is restricting, so they're not able to go to the bathroom, or you actually have the flow of your urine may slow down.
Yes.
And one of the bigger one, memory. Is killing cells. Inflammation will kill the cells.
Wow.
So those people are more likely to end up with dementia.
Sure.
Or any cognitive issues out there.
Right.
So people don't think about those things.
Yeah.
And if they're already dealing with this issue and then they have that poor neglect of their mouth.
Yes. Right. Then it's just drawing.
It's just downhill from there.
Wow.
And if they're already in a residential care facility, I know it's difficult to get the people to brush their teeth. But if you're going to visit, take that time to do it. You know, I know it can be frustrating and putting that energy into fighting them. But if you're there, do it.
Add it to what
you're doing when you go.
Yeah, I mean, you see that their skin's dry, you put lotion on. You see that they're in pain, you might give them, an Advil or ask for something. But
brushing, and then sometimes a lot of them know how to brush their teeth. They remember.
Sure.
But they don't have the tools to do so. Yeah. Or sometimes you just have to remind them.
Right. They're not necessarily going to ask.
Right. No, not at all. Because again, that's the last thing on a lot of people's list.
And I think they're learning a lot, and maybe it's just because I'm getting older and I have aches and pains that the internet and different things give you articles, based on what you look up and whatever. But it just seems like there's a lot more out there now with inflammation, things about inflammation, and the impact it has on pain, joint pain, and other things like lupus, and there are a lot more people being diagnosed, I think, and diet can have a lot to do with that.
Yeah.
So is eating different to eat healthy for your mouth, or is it just tied to the same things your body is tied to?
I think eating has to have a lot to do with a lot of things that we do and the types of foods that we eat, because we don't know what's going into a lot of the foods that are being processed. So when that stuff is processed, how it affects the body. Because cells, they need the nutrients that we put in, and if the nutrients are not coded a certain way, it will cause mutations. And those mutations become something that the body doesn't recognize. And if your body isn't able to fight it, then it becomes a condition.
A condition, right, that they put a label on.
Exactly.
Yeah, reading labels is really important. Very important. My mother went through a bout of stomach issues, and we still really don't have a reason why it happened. She works, she's 85, she works out 3 times a week, lifting weights and little cardio. Mentally she's there, and then all of a sudden she couldn't keep food down, and it lasted, I think it's about 1.5 years. And the only thing we can attribute it to is that she grew up or was an adult during the time when there were a lot of, 0-calorie foods. Danish that is low fat. I'm like, Mom, what's in it? How can you eat a Danish that's low fat? Like, there's some chemical in there. It's just your thing. There's some chemicals in there that, may not be easily digestible. And I think over time it just caught up with her. Right. So she had to go back to basics and start eating fresh only, nothing clean. Stop with the margarine, eat butter. You're 85 and you're in shape, you can afford to have a slab of, some butter. Get away from the margarine. What do they say? It's like a couple molecules away from petroleum, I think. So, I think diet's important.
Diet is important. I mean, just for overall health. And, we in the dental field, we always tell a patient the best way to look at it is the mouth is the gateway to the rest of your body.
Oh, I like that.
What you're putting into your mouth will affect the rest of the body. So if you think of that in a way, whatever you're putting in your mouth, that will be the answer to a lot of your problems.
And I do like what you mentioned early on about the acidity of foods and things like sodas and whatnot, and that the clock starts ticking, every time you take a sip. And I never thought of like brushing my teeth after, eating something. I usually
now with the brushing after you're eating, you want to watch that. You want to get your mouth in a neutral state before brushing, because if your mouth is acidic and you start brushing, you're affecting the enamel. So especially if you're a hard brusher,
I am.
or using a hard toothbrush, which I do not recommend. I know it feels like you're doing a better job, or it feels better, but it does more damage. So soft toothbrush or ultra soft.
Yes.
Because now you're using that acid to wear away that enamel. So you're helping it along.
Right.
So we'll give it a time. Rinse your mouth to neutralize and then brush.
Just learn something. And I was one of those people using the hard. Yeah, I'm just like, hey, I feel like I'm doing something here.
Yeah, it doesn't take a lot of pressure to take plaque away. Now, if you develop calculus, you need specialized tools to remove that. But tartar, plaque, it doesn't take a lot, and it's just rubbing. I even tell patients, if you don't have a toothbrush, get a rag. Salt, put some water on it, just rub your teeth if you don't have anything. The paper towel, use your finger. They sell these little things that you can put on your finger to rub away at the Dollar Tree, and just, put it in your purse or in your wallet and just rub it off your teeth to clean during the day. But yes, because please don't do that after eating.
Now, is it true that if you could only do one, floss or brush, that flossing is better?
I wouldn't even pit them against each other.
Okay, they're two.
Oh my gosh, they do two different jobs. The brushing gets the stuff off the surfaces that we can see. The floss gets the things from between the teeth. Because our teeth touch in between. And also the floss get the stuff that is below the gums. So when you have food in the gums, so it gets it out. So that when you brush, you're getting the rest of it out. Now I will put floss in water pick, where people kind of put it together. And they are not one and the same. Traditional flossing still is a better job than a water pick. So please don't trade them for the same.
Water all over myself.
I know. Bend over. It's a lot of pressure. So please floss and brush daily. Okay.
Well, we've got just like 1 or 2 minutes. Is there any message that you want to leave us with, or how we can reach you? We'll include a tag in the video also. But you got about 1 minute to share something. How do you want to leave us?
Well, I always tell patients, or people in general, God didn't give you a mouth and 38 teeth if he wanted you to lose one. So it's important to take care of it. Brush and floss daily. If you can't floss, allow somebody to help you. The picks are okay to use, just as long as you're using them. And if you need help, I am always here. I don't mind coming to show you how to properly brush or floss, or help you to take care of your family member and friends in a caregiving role as well. So
I think, some people know how to do it for themselves. But then when it comes to someone else, it's like tying your own tie versus tying somebody else's, right? So call on Camille, Dr. Camille.
Yes.
All right. Thank you so much.
Thank you, Miss Mary Lou.